ECMO stands for extracorporeal membrane oxygenation. Extracorporeal just means outside the body. So what we're doing, taking blood outside the body, outside the patient, putting it through a circuit that puts oxygen into the bloodstream and removes the carbon dioxide. We use ECMO for people that are having either heart attacks or major trouble with heart function, bad pneumonias, or lung failure. And now we've obviously used it quite a bit during this COVID pandemic. What ECMO can do for them is help give them extra oxygen. If their lungs aren't working well enough to get enough oxygen in the bloodstream, ECMO can help with that. It doesn't make the lungs any better, it doesn't make the heart any better, but it does give the patient hopefully some time to recover. We circulate the blood through the oxygenator, which adds the oxygen and then also removes the carbon dioxide. But the machine essentially is doing the work of putting oxygen into the bloodstream. The difference between ECMO and the ventilator can put in 100% oxygen, but still relies on the lung tissue to be able to process the oxygen and get it into the bloodstream. If the lung tissue is thickened or inflamed, you can put all the oxygen you want in the lungs, but it's not going to get into the bloodstream. These patients are in the intensive care unit, so they always have an intensive care unit nurse. The ECMO circuit requires a dedicated specialist to sort of monitor the circuit. At all times, we're looking at the amount of blood flow through the circuit, the amount of oxygenate through the circuit. We have dedicated ECMO specialists, and they are trained every 3 months in addressing any emergencies that develop. Having ECMO here and seeing some of these patients recover has been very gratifying. If we're able to maintain them without ECMO, that's always our first choice through the ventilator and medicines, and we really rely on our intensive care doctors to manage those people. In these last few months especially, patients that are getting the sickest are the unvaccinated patients, and we really haven't had to look at a vaccinated patient and even consider ECMO.